Very good morning. Honorable Minister of Health, Dr. Frank Anthony, Dr. William Adicro, Project Director of the Guyana Wellbeing Project, Professor Emmanuel Cummings, the University of Guyana, His Excellency Mark Bremen, the Canadian High Commissioner to Guyana, Dr. Renato Oliveira, representative from the Pan American Health Organization, Mr. Irfan Akhtar, a deputy representative for Guyana and Suriname for UNICEF, Ms. Alison Drayton, CARICOM Assistant Secretary General, Professor Christina Hoven, a professor of epidemiology from the Columbia University. Ladies and gentlemen, members of the press, welcome to the Arthur Chang Convention Center to the 2022 Guyana Mental Health and Wellbeing Conference. Welcome, and especially to those who are visiting Guyana and visiting Guyana for the very first time. We hope that you will be able to get the opportunity to visit other parts of our country. My name is Nazim Hussein, and it's my task to be the chairperson of today's proceedings. And without further ado, I will call the project director of the Guyana Wellbeing Project, Dr. William Adicro, to bring remarks.
Thank you, Mr. Hussein, Master of the ceremonies. I guess my task is to welcome you all here. Honorable Minister of Health, Dr. Frank Anthony, Professor Emmanuel Cummings, Deputy Vice Chancellor, University of Guyana, His Excellency Mr. Mark Berman, Canadian High Commissioner, who is always on time, Dr. Renato Oliveira, deputizing for PAHO representative, Dr. Codina, UNICEF Deputy Representative for Guyana and Suriname, Mr. Irfan Akhtar, CARICOM Assistant Secretary General, Ms. Alison Drayton, whom I've known for quite a number of years, Dr. Hoven, Professor Hoven, the overall head of the Guyana Mental Health and Wellbeing Project, colleagues from Ministry of Health and other government sectors, the youth from various schools, ladies and gentlemen. I wanted to start, like I said, my task is just to welcome you, but I wanted to ask this question, how did we get here? It started last year. Everybody knows with COVID, we're all indoors. We wanted to continue with our research to find out why we still continue to have suicides or self-harm in Guyana to the level that we do. And because of COVID, you couldn't go anywhere. And my boss always thinks ahead. Christina comes up with the idea, let's have a conference. And my first gut reaction was, where's the money coming from? Says, no, let's have it anyway. So said, so done. Without any money, we were able to get over 500 people participating in what I call knowledge diffusion, whereby we learn from each other. We try to get ideas from people who've tested various ways of controlling suicide or self-harm. And I believe we are better because we started this. So, Professor Hoven, thanks for your foresight. Initially I was very much against it, because I said we don't have money. But here we are. We have the second international annual conference on mental health and well-being. I would also want to take the opportunity to acknowledge the fact that we have very well-renowned speakers here with us, but there are some that are not here. And I'll leave that to Professor Hoven to make mention of them. But Professor Chandra, Professor Afzal Javed, Professor Levintova, Dr. Andrea Marquez, Dr. Maria Levintova, Professor Warren, Professor Norbert Skokauskas, Professor Wasserman. They are not here with us, but they are going to be joining us virtually. So, ladies and gentlemen, like they say on the plane, relax and enjoy what other persons have been able to come up with, so that we can all learn from one another. Welcome to Guyana and to the second International Conference on Mental Health and Well-being. Thank you.
Thank you very much, Dr. William Adekro, speaking on behalf of the Guyana Wellbeing team. Next, it's my pleasure to invite Professor Emmanuel Cummings from the University of Guyana to bring us remarks.
Thank you very much, Nazim, Master of Ceremonies. Honorable Minister of Health, Dr. Frank Anthony, Dr. Adekro, Director of the Guyana Wellness Project, a number of representatives from the diplomatic community that are here. Also want to recognize a number of distinguished individuals in the field of behavioral sciences, world-renowned, Professor Proba Chandra, Professor Afzal Jayed, Dr. Andrea Marquez, Professor Warren, Professor Norbert Skokotis, and Professor Wasserman. All, we're very pleased to have you here. And I'm really privileged and honored to be asked by the organizing committee to bring some brief remarks on behalf of the University of Guyana. From the inception, once Dr. Adekro is involved, once we have the blessing of our distinguished minister, that is catalyzed by an outstanding woman in the name of Professor Christina Hoven, we know this project will continue to be a great success. And certainly, the University of Guyana is very pleased to be part of this. I'm certain in Professor Hoven's remarks, she will certainly describe to you what is the current national and regional circumstance with respect to trauma and injury. We consider this second Health and Wellness Conference as being important as a university, and we are pleased to be involved in it as we develop strategies to address nationally events of injury and trauma. I just wanted to briefly indicate that the University of Guyana is significantly represented. The co-PI, Dr. Rita Gobin, Medical Director. We also have Mrs. Cara Lord and Ms. Leanna Kendall, psychologist, all involved in this project, apart from myself and many others. And to remind ourselves that this Guyana Research in Injury and Trauma Training, which is the umbrella body that hosts this conference, was established primarily as a consequence of a collaboration between Columbia University, University of Guyana, the Ministry of Health, and Georgetown Public Hospital. I wish to remind ourselves that this collaboration is designed to facilitate capacity building by providing in-depth training in research and design and methods to stimulate interest and to foster expertise in suicide trauma and injury prevention. Hence, this project is very much part and parcel as our mandate as a university. Over the next few days, we'll see a whole host of presentations that will not only stimulate your appetite, but also try to examine solutions to address a number of issues with respect to injury and trauma. You know, when I looked at the project of itself, and of course, as a country, and countries all over the world are guided by 17 United Nations Sustainable Developmental Goals. And this project addresses 7 of those goals. 7. Briefly, good health and well-being, gender equity, reduction of inequalities, sustainable cities and communities, peace, justice, and strong institutions and partnership. So it embraces a significant amount of the SDGs, which makes it even more relevant and important for us as a nation, even as we are on our upward developmental trajectory. So, ladies and gentlemen, we are well aware of the many injuries and violence which can be prevented through the collaboration of the relevant sectors, which is evident today in this second conference. It is now time to take the necessary action to stop the rising tide of injuries and violence. Certainly we have the leadership. The leadership and our presence truly demonstrates commitment by both your presence and your institution, as well as those that you have influenced nationally and internationally to address these matters of injury and trauma. We need to make our homes, our workplace, our schools, and our transportation much safer. Internally at the University of Guyana, we have had our own internal discussions, and we have decided that we'll have an interdisciplinary approach to address strategies of injury and trauma. And some of this will be reflected in the presentations. In closing, I wish that we have a very successful discussion, but after discussion that we continue with the relevant action so that our discussions will not go in vain. Tomorrow is our reward for working safe today. Thank you.
Thank you very much, Professor Emmanuel Cummings from the University of Guyana. At this point in time, I would also like to welcome those who are joining us via our Zoom link. Next, we've got brief remarks by His Excellency, Mr. Mark Berman, the Canadian High Commissioner to Guyana.
Thank you. Thank you very much. With all protocols observed, good morning, everyone. It really gives me great pleasure to bring greetings from the Government of Canada on the launch of the second Guyana Mental Health and Wellbeing Conference. I'm always a little intimidated making any type of presentation in a room full of medical health professionals. I come from a family of medical health professionals. My father, my uncles, my cousins, and I disappointed them all by becoming a lawyer, but that's my bridge to bear. This week's conference follows the blueprint that was established 1 year ago at this very venue, which was instrumental in bringing much needed attention to the issue of suicide and the legislative changes needed to create an enabling environment for addressing the country's mental health challenges. And having gone through the agenda, I was extremely impressed by the range of local and international expertise that's been mobilized for this conference, which is really a testimony to the level of importance that the government of Guyana has placed on mental health and well-being. In this regard, it's only fitting that I use this occasion on behalf of the Government of Canada to commend the Government of Guyana for recently passing the landmark Suicide Prevention Bill, which seeks, amongst other things, to decriminalize suicide in an effort to address the country's high incidence of cases. Canada is therefore extremely pleased not only to endorse, but to actively participate in this conference over the next few days. As you may have noticed, we will be officially launching a mental health project with Canadian partner, the International Development and Relief Foundation, IDRF, later this afternoon. Additionally, renowned clinical psychologist Dr. Taib Rashid, who is engaged through the project, will be leading a workshop on strengths-based resilience, SBR, as part of the wider conference. I'd like to take this opportunity to thank the organization for affording us the relevant space in an extremely packed program. I'd also like to recognize the government's partnership with Columbia University and their groundbreaking approach to understanding suicide in Guyana. I was fortunate enough to meet with the team just last month, and I received a first-hand account of their work. In closing, I wish to commend the government of Guyana, particularly the Ministry of Health, under the stewardship of Minister Frank Anthony, for its continued commitment to improving mental health and well-being for all Guyanese. And to all attendees, I wish you all a very productive and stimulating week ahead. Thank you so much.
Thank you very much, Your Excellency. Next, we've got brief remarks from Dr. Renato Oliveira. He is making remarks on behalf of the PAHO representative in Guyana.
Good morning, everyone. Distinguished authorities, honored guests, ladies and gentlemen. My name is Renato Oliveira. I'm Chief of the Mental Health and Substance Use Unit at the PAHO headquarters in Washington, D.C., and I'm speaking on behalf of the PAHO WHO representative, Dr. Luis Codina. It's my really great pleasure to welcome you to this important Guyana Mental Health and Wellbeing Conference in 2022. We all know by now that the COVID-19 pandemic has adversely impacted the mental health and well-being of everyone, everywhere. We have seen rates of stress, depression, and anxiety increase in our region, and persons living in conditions of vulnerability who have traditionally experienced a higher burden of mental health conditions and unequal access to care being among those most affected. Our young people have been also disproportionately impacted by the pandemic, and their lives have been upended by extended school closures, the inability to form usual social relationships, and to also enjoy the rites of passage so important to our youth, while they experience the loss of caregivers and loved ones, and now uncertain futures. The overall impact of the pandemic is still being evaluated as we continue to learn about post-COVID-19 conditions and their also long-term mental health consequences. PAHO member states have found innovative approaches to respond to mental health demands during the COVID-19 pandemic. including the creation of intersectoral mental health and psychosocial support working groups, expansion of telemental health, and some countries also launched presidential and interministerial initiatives to address the impact of COVID on mental health and build back better. But much more is needed to ensure a true transformation of mental health through increased political action at the highest level, strengthen multi-sectoral partnerships, investments in infrastructure, human resources and services, and providing care in the community where it's most effective, while ensuring access to universal mental health care as the region works to build back even better. As we look to the future, we must ensure the recovery of mental health in our region, not only in the context of recovery from the pandemic, but also to address the ever-present public health emergencies and humanitarian crises linked to violence and natural disasters. I must also mention the often unseen toll that climate change creates for mental health conditions in the region of the Americas. We must address mental health in the region of the Americas holistically to consider individual and community emotional well-being, self-care, elimination of barriers to accessing care such as stigma and discrimination in order to achieve optimal social well-being and sustainable development. I would like to express my sincere gratitude to the organizers for inviting us to participate. Let me also congratulate the government of Guyana for their leadership in advancing mental health in our region, which is clearly seen in the passage of recent mental health and suicide prevention bills. PAHO is more than ever committed to advance mental health in the region of the Americas. The new regional mental health policy approved by all member states in the last Pan American Sanitary Conference and the PAHO Commission on Mental Health and COVID-19 created by the PAHO director are clear examples of that. I anticipate that this conference will be another opportunity for us to find better and more innovative ways to work together and create and strengthen partnerships and add to the body of knowledge and that will be available to guide evidence-based decision-making for better mental health outcomes in Guyana, but also in the region of the Americas. I wish you all a great conference. Thank you very much.
Thank you very much, Dr. Renato Oliveira. Next, brief remarks from the UNICEF Deputy Representative for Guyana and Suriname, Mr. Irfan Akhtar.
Thank you, Mr. Chairperson, and good morning to all protocols observed, and greetings from UNICEF. UNICEF is very pleased to be here today for the launch of the second annual Mental Health Conference in Guyana. This is a really very proud moment for Guyana to be surrounded by international mental health experts and eminent speakers today. I'm sure we all will benefit from the wisdom, from the academic research and learnings which they will be presenting during this conference. I thank the Ministry of Health and partners, especially University of Columbia, for organizing this event, which provides excellent opportunity for reflections on mental health in the region, in Guyana, as well as globally. I really would like to applaud Honorable Minister of Health and University of Guyana, and then Dr. Adukro for organizing this conference. As we all know that mental health is a global issue. And it's a time to create awareness and advocate for favorable policies and plans and strategies to improve the mental health of the people in any country. And I see Guyana is taking the leading role in this regard. According to a recent estimate, 1 in 10 children and adolescents have a mental health condition globally. And 1 in 5 children are living with a caregiver who has mental condition. It means The issue is not easy as we think. It's a quite serious, but probably we are not able to identify, diagnose, and provide the supportive and enabling environment to improve the mental health. The COVID pandemic has significant impact on all of us, including children. It has created serious concern about the mental health of children and their families everywhere. And Guyana and the region is not excluded. We have all gone through the difficult time of COVID pandemic. Even before COVID pandemic, children and young people carried the burden of mental health conditions. And now, when the schools are opening, you can see the impact of COVID on their mental health and psychosocial well-being status when they are behaving in the school, when they're interacting with their friends, and there are so many changes in their personality. Mental health is probably it's time to redefine how people perceive it. It's not a disorder, but always is stigmatized. For me and UNICEF, we believe that mental health is a fundamental part of overall health and well-being. It is a positive state of the well-being which need to be nurtured and cared for. At the same time, we are living in SDG era, and mental health is an integral part of the Sustainable Development Goals. And I believe, and probably we all agree, without achieving the mental health, we cannot realize the Sustainable Development Goals. If we are aspired to achieve the Sustainable Development Goal, mental health must be integral part of the overall health program. Promoting and protecting and care for children's and young people's mental health will play important role in achieving not SDG 3, but other 17 SDGs, because all SDGs are interconnected and dependent to each other. At UNICEF, we believe that every child has the right to survive, thrive, and grow up in a safe and protective environment, including access to quality mental health and psychosocial support. Mental health is a global priority for UNICEF, and I'm very pleased to share that Ghana is one of the pilot countries for UNICEF Global Mental Health Initiative. I'm also pleased to share that UNICEF and WHO has signed a global MOU and joint prom on mental health, and Ghana is going to be one of the countries. By having all these initiatives means we'll have more opportunities, more technical support, and more resources to work on mental health in Ghana. UNICEF's report on the state of world children 2021 focuses on promoting, protecting, and caring for children's mental health. This is the first ever report which UNICEF has produced, which is focusing on mental health. There have been several reports focusing on different issues, violence against children, learning outcomes, but this time, in view of COVID pandemic, for the first time, UNICEF took a very comprehensive look to look at the status of mental health of children. So this is what we are looking forward to, that mental health should be the priority of 21st century. The state of the world's children calls on governments, public and private partners for several actions, including urgent investment in mental health as it remains unfunded. If you see the budget allocation expenditure by sector, health sector, any health sector, particularly mental health, is very low. We all recognize that mental health is important, so we should pledge to invest more in mental health. Second, integrating mental health intervention across all sectors, health, education, and social protection. Mental health should not be kept within health. Mental health is no more only a health problem. It's a beyond health problem. It should be integrated in all sectors, education, social protection. And at UNICEF, we are closely working with the Ministry of Education also to provide psychosocial mental support to children in school. At the same time, we are also working with other ministries, especially Ministry of Human Services, Social Protection, to make sure that access to mental health and psychosocial support is available to children in institutions, whether they are in juvenile center or detention center. They have access to psychosocial support. Third is breaking the silence surrounding mental health through addressing the stigma and promoting better understanding of mental health. We know there are different interpretations. Talking about mental health has been a stigma and discrimination. People have been, keeping it themselves when they go through a difficult time. But it's time to break the silence, to talk openly about mental health, and to embrace the issues of mental health. Lastly, we must not focus only the clinical aspect of mental health. Mental health must go out of the clinic. It should be a discussion at community level. It should be discussed at family level. It should be everybody's discussion so that we can bring multi-sectoral approach. UNICEF stands ready to work with the Ministry of Health under the leadership of Honorable Minister. Other partners like University of Columbia, civil society organizations, and most importantly, youth groups. We have been working together, will continue to work to strengthen the mental health systems and also scaling of key intervention services so that mental health is available, accessible to everyone, everywhere. Thank you so much.
Thank you, Mr. Irfan Akhtar. Next, it's my pleasure to invite Ms. Alison Drayton, the CARICOM Assistant to the Secretary General, to bring us brief remarks.
Good morning, everyone. All protocols observed, and I promise I will be that rare speaker who says I will be short, and I will be very short, and I'm not referring to my height. I would like to congratulate everybody involved in organizing this important conference. It is wonderful to see the issue of mental health finally come to the fore, particularly in this region, which, as we all know, historically has swept this under the bed. So kudos to all of you. As highlighted by the previous speakers, it is critical to address this issue, given the profound impact on our societies, not only after the last 2.5 years of the pandemic, but also I think we seldom treat with the impact on those of us who deal constantly with the constant and existential threats caused by extreme weather events linked to climate change. And I'm very pleased that in the last, I would say just in the last decade, for those responders who go in to help countries recover from an event, the issue of psychosocial support, as highlighted by UNICEF and PAHO, has become an integral part of the package of recovery. We also need to speak of this issue openly, given the levels of depression and suicide in our societies and the concomitant impact on other health issues. I am very sure that the high levels of NCDs in our region are not just due to a very unhealthy lifestyle, but in fact, issues of mental health do go down through the body. It is in fact one. I would particularly stress the need to look at the issue in terms of the link to violence, as again, previous speakers have highlighted, particularly domestic violence. The Caribbean, which loves to lead, I would sadly note, is very good at leading with some absolutely appalling figures on violence, particularly gender-based violence. And we need to deal with this as one of our priority areas. Again, congratulations to all and for bringing this issue to the fore, and I look forward to very interesting discussions and the meat of the keynote address. Thank you.
Thank you there, Assistant Secretary General, Ms. Alison Drayton, Assistant Secretary General from CARICOM.